Mary and David just had HIV tests done. Mary is negative. David is positive with HIV, human immunodeficiency virus, which causes the medical condition AIDS, acquired immunodeficiency syndrome. He is a banker and married with 2 kids. And questions arise. How did David get infected with HIV? What should David do now? Anne has been living with HIV for 12 years now, enrolled for the program and has been on treatment. She is living a normal life. While Sean discovered he had HIV only a year ago, he has refused to enroll for the program, has refused to go for treatment, and is seriously ill with AIDS. And he is suffering all forms of discrimination. David knows this much, that AIDS is a syndrome caused by a virus called HIV. However, David does not know that the disease alters the immune system, making people much more vulnerable to infections and diseases. People, when infected, have the virus throughout all the tissues of the body, but can transmit the virus to other people via bodily fluids like semen, vaginal fluids, blood, and breast milk. Following initial infection, a person may not notice any symptoms or may experience a brief period of influenza-like illnesses with symptoms of fever, shivering, chills, malaise, dry cough, loss of appetite, body aches and nausea. Typically, this is followed by a prolonged period with no symptoms. As the infection progresses, it interferes more with the immune system, increasing the risk of common infections like tuberculosis, as well as other opportunistic infections and tumors that rarely affect people who have working immune systems. These late symptoms of infection are referred to as acquired immunodeficiency syndrome, AIDS. This stage is often also associated with weight loss. What are the possible ways David could have contracted HIV? The National Guidelines for HIV Prevention, Treatment and Care 2016 documented the following in Nigeria. Over 90% of HIV transmission is via unprotected sexual intercourse between heterosexual or homosexual individuals. Certain conditions and circumstances predispose one to contracting the disease, like having to do sexual work. Another condition is transactional sex experience, which occurs when money, gifts, or favors are exchanged for sex. Other prominent modes of transmission of HIV could be from the HIV-positive mother to her child, mother-to-child transmission, MTCT. This can occur during pregnancy, labor and delivery, childbirth, or during breastfeeding. In the absence of intervention, the risk of such transmission is 15 to 45%. Other modes of contracting HIV include transfusion with infected blood and blood products, contact with sharp piercing objects, used for scarification, tattoos, and surgical procedures, unprotected anal sex, sharing needles and syringes, being stuck by HIV-contaminated needles or sharp objects, intravenous injection drug users, oral sex, contact between broken skin, wounds, or mucous membranes and HIV-infected blood or blood-contaminated bodily fluids. What if I told you that in 2016, about 36.7 million people were living with HIV, and it resulted in 1 million deaths? Between its discovery and 2014, AIDS has caused an estimated 39 million deaths worldwide. HIV/AIDS is considered a pandemic, a disease outbreak which is present over a large area and is actively spreading. Did you know that the first case of AIDS in Nigeria was reported in 1986? Since then, national HIV prevalence has increased exponentially from 1.8% in 1991, peaking at 5.8% in 2001, and progressively declining since then to the current figure of 3.1% in 2014. Nigeria has the second highest burden of HIV globally, with 3.4 million people living with HIV/AIDS as at 2014. Did you also know Nigeria has the second largest global burden of HIV/AIDS, with an estimated 380,000 children living with HIV by the end of 2014, making the country home to over 30% of the global burden of HIV-infected children. The Joint United Nations Programme on HIV/AIDS, UNAIDS, was launched in 1996 to strengthen the way in which the United Nations was responding to AIDS. And in 2001, the Declaration of Commitment on HIV/AIDS Global Crisis, Global Action by the United Nations was made. Despite efforts by stakeholders at prevention, messages, and awareness, people are not willing to admit they're infected. People are not enrolling for the program, and people are not taking care of themselves. And this has been the result. So what should David do now that he has contracted HIV? That is easy. To continue living a normal, healthy life, David should go to a government-approved HIV treatment center, enroll for the program, and ensure he commences appropriate treatment with antiretroviral therapy, ART. He would also be counseled on proper lifestyle and activities to protect him and those around him. Did you know that if someone with HIV is taking effective HIV treatment and has an undetectable viral load, they cannot pass on HIV? It can take up to 6 months of treatment for some people to become undetectable. It's now recommended that everyone diagnosed with HIV starts treatment straight away, regardless of their CD4 count. Doctors use 2 key tests to assess the strength of your immune system: a CD4 cell count and a viral load test. HIV damages your immune system by destroying the CD4 cells of the immune system after the virus has used the CD4 cells to replicate. Even though you may look and feel well, a high CD4 count translates to a strong immune system, and a low CD4 count translates to a weak immune system. This treatment can be as simple as taking 1 or 2 pills once a day. Successful HIV treatment means you can expect to live as long as anybody else. Once your treatment is working properly, you may only have to see a doctor once or twice a year. You can have a sex life with no risk of passing on HIV if you're on effective treatment and your viral load is undetectable. The viral load test shows how much HIV is in your body by measuring how many particles of HIV are in a blood sample. HIV-positive parents can have HIV-negative children. Great! This means that Anne can live a very long and healthy life, have a family and kids like anyone else, and Sean still has a chance to be well again and be like Anne and Mary. All he has to do is go back for the right treatment at an appropriate government-approved HIV treatment center and enroll for the program. What is more awesome is that Mary and everyone else who is free of HIV can prevent HIV/AIDS and never have to contract it by ensuring the following: avoid unprotected sex, use condoms, avoid unhealthy sexual behavior, sexual abstinence where relevant, avoid needle-sharing activities, avoid contact between broken skin, wounds or mucous membranes, and HIV-infected blood or blood-contaminated body fluids. Get the right knowledge and information from appropriate sources. Did you know that PMTCT, prevention of mother-to-child transmission of HIV, greatly reduces the risk of transmission to children? In the absence of PMTCT, the risk of mother-to-child transmission of HIV is 25 to 40%. PMTCT prevents the transmission of HIV from mothers to children and can reduce rates of transmission by 92 to 99%. And what if I told you that treatment administered within 48 to 72 hours after exposure to HIV-positive blood or genital secretions is referred to as post-exposure prophylaxis? This can prevent you from contracting AIDS. A strategic way to prevent reinfection, treatment facilities encourage those who were previously treated for HIV to return and ensure that the infection is being successfully managed. In 2013, the HIV Care Continuum Initiative was established as the next step in the implementation of the National HIV/AIDS Strategy. HIV Care Continuum, also called HIV Treatment Cascade, is the series of steps a person with HIV takes from initial diagnosis to their successful treatment with HIV medication, or stages of HIV medical care that people living with HIV go through from initial diagnosis to achieving the goal of viral suppression, that is, a very low level of HIV in the body. The stages of the continuum are HIV testing and diagnosis, getting and staying in medical care, getting on antiretroviral therapy, achieving viral suppression. These recommendations were fully integrated into the steps and actions of the National HIV/AIDS Strategy. Treatment for All, UNAIDS has proposed a new, final, ambitious but achievable target, the 90-90-90 treatment target. By 2020, 90% of all people living with HIV will know their status. By 2020, 90% of all people diagnosed with HIV infections will receive sustained antiretroviral therapy. By 2020, 90% of all people receiving antiretroviral therapy will have viral suppression. This is why Mary, David, Anne, and Sean can all live normal, healthy family lives. What if I tell you that 2016 records show that people who are living with HIV and know their status, 34% are in Nigeria, 45% in Sub-Saharan Africa, 11% in Yemen, and 87% in Netherlands. People who are living with HIV and are in treatment, 30% of them are in Nigeria, 39% in Sub-Saharan Africa, 3% in Afghanistan, and 71% in Switzerland. People who are living with HIV and are virally suppressed, 24% live in Nigeria, 29% in Sub-Saharan Africa, 7% in China, 68% in Switzerland. As we can all see, some countries are doing well. Nigeria is on track and we can reach these targets so that we can achieve viral suppression towards an AIDS-free world by 2030. Let us join the National Assembly Coalition Against HIV in collaboration, partnership with both the leadership management of both houses, Senate and the House of Representatives, and all our stakeholders towards increasing impact through transparency, accountability, and partnership to achieve the Know Your Status campaign and ending AIDS in 2030. Let's End It 2030. This message was brought to you courtesy of NASCOA, National Assembly Coalition Against HIV/AIDS, in collaboration with SCDL, Spordust Content Distribution Limited, UNAIDS, Joint United Nations Program on HIV/AIDS, the Federal Ministry of Health, and NACA, National Agency for Coordinating HIV/AIDS.